thank you so much for joining us again. I hope you've enjoyed our previous episodes. And my name's Anna. I am a final year medical student at King's College London, and I also work with Medics Academy on their SDocs programme. But that's not the reason I'm here today. The reason I'm here today is because I am thinking about maybe applying for the Academic Foundation programme, and I wanted to hear from the people who know most about it, which is people who are going through it and have gone through the application process. So today I think is going to be quite a hotly anticipated episode of the series, because we're going to be talking about something that I think people find quite daunting about applying for an academic foundation position, which is the interview process. And I know for a lot of people, they might not necessarily have had an interview since they went to medical school, which may have been a few years ago. So hopefully we can break down some of the myths and legends and give some tips for people on how to prepare. So I'm absolutely delighted to be joined again by some of our fabulous AFP doctors. So I'm going to go around and get you all to introduce yourselves. You might recognise some of them from previous episodes. So we'll start with Nikki, if that's all right.
Hi everyone, my name's Nikki. I'm currently an F2 who's on the Academic Foundation Programme block at the moment. My AFP is in Paediatrics at Imperial College London.
And Dimitri, could you introduce yourself, please?
Hi everyone, my name is Dimitrios. I am currently an academic F1 in Oxford, and my academic block is at the end of F2.
And Faris.
Hello everyone, so my name is Faris. I'm currently one of the Wales Academic Foundation Year 1 doctors, and the academic time is built throughout the entirety of the F1 year, and I'm currently on my paediatric block.
Well, thank you guys all so much for being here with me again and sharing some of your wisdom and expertise about the AFP. So let's start with Nikki. Tell me a little bit about your experience interviewing for your academic foundation post.
Yeah, so my academic foundation programme job is the one in the London Deanery. So just in terms of the interview part of the process, essentially there are two interviews. There's a clinical interview and an academic interview. So that's probably the main thing to bear in mind and be aware of. On the day, I obviously had to go and do it in person. I understand that this year's applications are most likely online and virtual, but in terms of an interview process, it's probably relatively very similar. Two separate interviews, they last 10 minutes each. When I first arrived there, I had 25 minutes in a room where I was given an academic abstract. Most of the times this abstract comes from the New England Journal of Medicine or a very high up reputable journal. And I was also given a clinical scenario, which for my interview happened to have 3 patient scenarios or 3 patient situations that I had to think about. But that can really vary between 2 and 3 is probably what's most common. And I had time with a blank piece of paper and a pen and nothing else in there to sit in silence to prepare whatever I wanted to for those 25 minutes. Essentially, obviously, the abstract was for the academic interview and the clinical scenario was for my clinical interview. Then you get taken to, so I guess in this situation, you'd be starting for one of your interviews. When I was there on the day, I didn't actually know which one I would be starting on first. So that's just something to be mentally prepared for, is that you don't necessarily know if you're going to go into clinical interview first or the academic interview first. Found out literally with the 1 or 2 minutes before you go inside the room. And I went inside. My first interview happened to be the clinical interview. Now, the thing to bear in mind for this is that I had 2 interviewers. This is likely going to be the same for anyone who has an interview in London virtually as well. They were 2 very senior clinicians. I didn't know them or had never seen them before. So it's likely that more like an OSCE situation where you don't really know your examiners. It's a little bit intimidating, but they're quite friendly in general. Part of the clinical interview is going through your ABCD approach, because the clinical scenarios tend to have quite an acute element to them. And the real purpose of them having this clinical interview in general is because, as we discussed in previous of these episodes as well, is that as when you do an academic foundation program, you do have 4 months less or less time in general, because you have protected research or teaching or AFP block time that you don't have to do your clinical competencies in. And so they want to make sure that they're happy with you clinically, and that they're confident that you could perform and that you'll be a safe doctor, and that you can do without those 4 months or that period of time to achieve your clinical competencies. So they're really just trying to see, are you a safe F1? Are you knowledgeable enough that you understand what emergencies you might be presented with, and that you can deal with that? So your prioritization, your time management skills. And there's often also an ethical component to that. So that's something to really brush up on your consent, confidentiality principles as well. I'm going to get to some book recommendations later on, but just let's move on a little bit to the academic interview. The academic interview has almost 2 parts to it in London. It's also 10 minutes in length. And an important fact is that actually after you finish your first interview, you have 5 minutes, or at least this is what I had on the day. So hopefully virtually they'll be able to simulate the same sort of situation. We have 5 minutes to prepare the other interview stuff. So you get a bit of a break. It gives the examiners time to talk to each other and decide their marks for you for that station. And you literally just think about, so I, in that 5 minutes, was just thinking about the abstract and trying to refresh my mind about what I tried to prep in that 25 minutes. You then go inside. So obviously there'd be another 2 examiners virtually interviewing you. With this, there's 2 parts to it. So there's personal questions, and then there's talking about the abstract that you've been given and that you've prepared. In terms of the personal questions, it's likely they're going to ask you, why do you want to do the academic foundation program? Tell me a little bit about your research or some of your achievements. So they're really just trying to see what your aims, motivations are, and ultimately get a little bit of a flavor of what kind of a person you are and whether you'd be suitable to the programs that they're offering. And then after that, they moved me on a few minutes after that onto the abstract. They gave me a couple of minutes to talk about it, and then my experience was that my interviews were really lovely, but they questioned me quite a lot about different aspects that were quite different to the way I'd prepared and used my structure for prepping and critiquing an abstract. But I think the experience of this is quite varied for all interviews in general, both the clinical and the academic, but some places interviewers will let you talk through your whole critiquing spiel, and in other places they will stop you very early on and they will ask you several questions about the abstract that they want to know. Again, I would recommend for this part, and this happened to me in my interview, they ask about research ethics, so it's always good to think about the ethical side of things with that as well. Time goes very quickly, and before you know it, you're out of there. So enjoy the process, and although it is scary and nerve-wracking, the adrenaline keeps you going as it does in OSCEs or PACEs, and you'll be absolutely fine.
Wow, that's great. Thank you so much. I feel like that was a really comprehensive overview of the interview process that you went through. And I know that I really like hearing people's personal experiences rather than just, you know, the stuff that you can find on the deanery websites. And that's one of the reasons why we wanted to do this series. So thank you so much. But Faris, it'd be great to hear the same from you, because I know you're in Wales and it's quite a different programme. Is the application process and the interview process different?
Yes, so the actual interview process is actually quite similar to what was just described. So in a very similar manner, I had 2 interviews, again, one academic and one clinical. I suppose the biggest difference compared to what it seems to be done in London is that the academic component didn't include critical appraisal, which, to be honest, I didn't actually realise until the actual day of the interview. So it's very possible that they might change that, but they didn't inform us exactly what it would be composed of before I turned up for my interview. And I remember the interview very well because it was the day after I had one of my Year 5 finals papers. So to be honest, I had done some preparation for it, but I hadn't done as much as I would have liked because of having that exam the day before. And on the day itself, in a very similar manner. You had to turn up, wait for about 20 minutes. We weren't given a paper or anything to read over. We were just sort of left to have tea or coffee while we waited to have our interviews. And again, we had one clinical interview that was 10 minutes long and one academic interview, which was 10 minutes long as well. And we had 3 panelists. They were doctors who I'd never met before. And again, it very much felt like a clinical final scenario, but they were all very lovely. I had my clinical interview first, and what I would say is that the sort of scenarios that they questioned me on for the vast majority of the interview were very similar to what would be an acute or an emergency style station within an OSCE format or a clinical finals exam. They essentially want you to be to demonstrate that you will be a competent and a responsible F1 is what I gathered from the process. Given what we've already discussed in the previous sessions, whether you do a set format block within a 2-year program, or you do an academic foundation year program like myself, which means you get protected days for your own academic activities, you do lose out on some clinical time. So they want you to demonstrate that you'll still be able to achieve everything that an F1 or an F2 would be expected to achieve, whether or not they would be academic. So those were the sorts of questions I asked. And if you're preparing for OSCEs or clinical finals, if you've got that, that will actually supplement, I would say, your preparation for that. And I found the questions quite grueling, not as grueling as I would say that an OSCE would be, because you don't have to examine a patient, and definitely most likely this year, you won't have to do sort of anything practical. But if you're able to talk through how you would manage a patient in an emergency setting, such as the emergency department, or coming through very unwell in the GP setting, then you're going to do absolutely smashingly in that side of the interview. I also got questioned on sort of common things that an F1 would be expected to do. So what I would say is just make sure that you've remembered what you see in the F1 and the F2 do on each of your placement blocks, whether that be in general medicine or surgery, one of the more specialist blocks. There are certain key things that an F1 would be expected to be responsible for, and that might include things such as writing discharge letters, such as clerking in patients, just being familiar with the responsibilities that you'll have to do within your F1 and F2 year. And then the academic side of the interview that I had, I would say was quite similar to what was described as happening in London, in that I was asked questions about why do I want to apply for this program? Can you tell me about some of your medical education and leadership interests? Which were all reasonably comfortable to answer because I'd thought about those things before turning up to the interview. I also got questioned along the lines of what I would prioritize, whether that be academic commitments or your clinical commitments. And what I would say is that regardless of whether you're an academic doctor or not, as a junior doctor, you have to be sort of very clear in your mindset that patients are the absolute priority and working with your team is the absolute priority. And if you've got that certain mindset in your head, when you get asked those sort of ethical scenarios, it becomes a lot clearer what's the correct answer to go for when you're asked those certain questions. I also got asked at the end of both my academic and my clinical interviews if there was anything I would like to ask of the panelists in front of me. And what I would say is that from that, they actually asked me a couple more questions in regards to the answers that I gave them in terms of what I asked, which was in respect to what how it would work with the academic time and with the supervisors. So just be prepared as well to think about what you would actually like to ask of the panelists and what you want to know a bit more about with regards to the programme.
That's great. Thank you so much. And Dimitri, what was your experience like? I'm sure that Nikki and Faris have covered a lot of kind of similar themes that you might have also experienced. But yeah, how was your interview?
So I applied in Oxford and Cambridge, and they were quite different, but they were helpful as well because I had one day after the other, both interviews. So it was good preparation. I started with Cambridge, and Cambridge surprised me in that they don't have a separate clinical and academic interview. They have a 25-30 minutes interview, which is both the clinical and the academic, and you're with the same panel. That panel is decided based on the stream you select. So last year when you applied for Cambridge, you put down some preferences depending on your research interests. And there are some people who work in that department and some people who don't work in that department. And they started with a clinical scenario, and they wanted you to sort of delve deep into that scenario, and they kept asking questions, push the UC as far as you can go, but nothing out of the ordinary. This isn't registrar knowledge. This is stuff you're expected to know as an F1. And always remember, many people don't do well in the clinical station, so don't feel like you're not doing well. Always remember this is comparative in the interviews. And then with the same panel, they proceed to academic questions, and I felt Cambridge, they do value your CV a lot, so they have your CV in front of them and your white space questions, and they ask you a lot about yourself, they're very much interested in the person. So I'd say if you've done a PhD, you would probably have an advantage at Cambridge, because it felt that the application counts a lot, even on the day of the interview. Personally, I didn't feel I did very well in the interview, but I ended up getting an offer and I was extremely happy. And then the next day I had the Oxford interview, which I was stressed, but I must say that having the interview the day before did help with the levels of stress. So that's another thing to keep in mind. Try and schedule your interviews close to one another. It does help. The Oxford interview was quite different. So it was two separate interviews, the academic and the clinical. The academic, there were some interesting questions that they wanted to see how you think on the spot, rather than the textbook questions that one would expect, such as why AFP. And then the clinical was again different from Cambridge, in the sense that there were different scenarios, and you would go through several scenarios, maybe 2 or 3, which are again common to test your knowledge on diagnosis, management, and so on and so forth. I'd say they were quite different in many ways, but they were both quite interesting experiences. One does prepare you for another, and the same things in terms of being confident and in terms of knowing your white space questions apply very well for both. Oh, and I must say, before I forget, because it is a theme in London and everywhere else, in many other places, Oxford and Cambridge did not ask for a research paper for like a critical appraisal, but because you're applying to an academic program, I would just say, if you've seen anything interesting in the news the last couple of weeks, maybe a month, just read it a bit better than you do. Instead of just skimming the abstract, have a few numbers, a few key results on your mind, just in case you get asked about anything interesting you read recently, but it didn't happen to me.
That's great. Thank you so much. That's really interesting to hear about all of your quite diverse experiences in different deaneries. So this time, let's start with Faris. What advice would you give to people who are preparing for their AFP interview?
So the main points of advice I would give myself, if I could go back in time and talk to myself again before prepping for the interview, there's a really great resource on Medics Academy itself, which I wasn't aware of at the time. It's how to get into the AFP program. It's done by Dr. George Miller, a doctor who's previously talked on this series, and it's actually really useful for going through critical appraisal and for going through the interview and applying for the AFP in general. And it's probably the best resource I've actually seen about applying for the AFP and for prepping for the interview. So I would definitely have used that at the time. It would have made the whole process of applying and preparing for the interview a lot less stressful. I also, at the time, used a book called The Secrets of AFP, which you can get off Amazon. It was given to me as a present. It's quite a short book, but I found it very useful because it was good at looking at reasonably last minute, within a week or so of the actual interview, and actually sort of focusing my mind on perhaps what to expect and what to prepare for. And my final piece of advice would be, obviously the interviews are going to be quite different this year if they're being done online. And what I would say is try to have some form of practice doing an interview. So what I did for myself last year is I got some of my other medical student colleagues at the time just to give me sort of a 20-minute interview. It wasn't exactly prescriptive of what I had, but it sort of got me in the right mindset for preparing for the interview itself. So what I would advise people to do this year is to try and do that over something like Zoom, because it is very different having an interview done online via Zoom or a similar platform compared to doing it face to face. And it proposes different sorts of challenges. And the best way that you can prepare for that, because the chances are most people are not going to be very experienced at doing those sorts of interviews, is to simulate it as much as possible. So that would be my best tip for this year, is to try practicing doing that.
I think that's a really, really good idea. It's definitely different doing things over Zoom or even Teams than it is doing things face to face. And I think there's a lot of considerations that you have to have about like your setting and even your internet and things like that. So I think that's a really great point. Nikki, I believe you had some books to recommend as well.
Yeah, so I have a couple of book recommendations that I personally use to help me prepare for both of my interviews in London. So one is particularly useful for the academic interview, especially in regards to critiquing a research paper and having a structure for that and understanding the statistics and all that other stuff that comes with doing that. And that's called, it's a book by Pass Test, and it's called The Doctor's Guide to Critical Appraisal. And I actually found it was the easiest book to read and understand and digest everything from. So I highly recommend that one. And then for the clinical interview, I mean, a lot of people will obviously say the back of the Oxford Handbook, The Cheese and Onion, has a great emergency section. And I did use that, but I think it's important to remember that when you're preparing for an interview, it's not completely comprehensive of all medical emergencies that are out there. So I did start off with that, but the book that I used to supplement my knowledge in terms of emergencies is a book called Medical and Surgical Emergencies, the ABCDE Approach. And this had a wider range of medical emergencies, all approached in ABCDE format. So those are like the book recommendations. And then I just have a couple of other really points of advice or tips that I would that I personally found that really helped me. And the first one is, if you're interested in a particular AFP, try your best to find out who might be doing the academic foundation program post, or someone who's gone through it. It's a very small world and a very small network. If you know one AFP doctor, the likelihood is they know someone in that deanery who knows that person doing that job that you're interested in. So if you dig a little deeper, you might be able to find that person, because they're the best person to really give you a true idea of the interview process and exactly what that AFP is like. And on that same note is that if you speak to people at different stages, so I spoke to some clinical lecturers, so people higher up in the academic training pathway, some ACF doctors, and also some AFP doctors. And they all gave me slightly different points, but it was really good to do mocks with all of them. Even if you just get one of each, let's say, because the clinical lecturer will say what they think of from a senior point of view, and they might be more similar to your interview mindset versus the younger doctor who's just doing the AFP, who might have just been through the process and know the most up-to-date information. And finally, one thing that I found that really, really, really helped me is I wrote out my A to E approach, which sounds very practiced and rehearsed, but it's like an OSCE. The more confident you are with your ABCD approach, and the more you can just say it as if someone wakes you up in the middle of the night, waking you up from being in deep sleep, and they say, tell me your ATE approach, and you can just rattle it off. That's the stage you want to get at by the time you're getting to the interview, that is so comfortable with that. And then you just need to add the little details in for the specific condition. So I actually wrote mine out as a script, and I found that super useful. Good luck, everyone.
Thank you so much, Nikki. I think that's a really, really good tip. And I think if people are preparing for finals at the same time, that's actually probably quite good revision for finals as well. So I guess it might seem like you're spending a lot of time on kind of non-clinical work, but actually there is quite a lot of clinical input in the preparation for AFP interviews. So Dimitri, is there anything that you'd like to add that hasn't been said so far?
Yes, my 3 top tips, and I'll categorize them in terms of what you can do before the interview, one about yourself and one about the clinical knowledge. So number 1, the game starts long before the interview. So your success on interview date depends on what you do way before the interview. And what I mean by that is you need to know your white space questions by heart, know everything you write there, because you may be asked. And if you mention any interesting therapies or any scientific terms, be ready to be challenged about them. So don't dig a hole for yourself before the interview. So that would be my number one tip. Number two, about yourself. A lot about your appearance. So I would focus, if you're a good communicator, fine. But if, like me, you're not the best communicator, I would watch some YouTube videos on the value of nonverbal communication, on how to be confident, and if you're not confident, how to appear confident. And of course, dressing nicely also helps, because you are feeling more comfortable with yourself and you're also looking smart, which is always a plus. And my number three tip, which is really important, is how you prepare for the clinical interview, because many people, as I said, don't do well in the clinical interview. So this is the deciding factor. And the best for this, in my opinion, would be to know the last few pages of the Oxford Handbook of Clinical Medicine cold. I know this is a cliche, but if you know them cold, trust me, you're going to do very well. There's more than you need there. It's impossible to memorize everything, but if you memorize that as much as possible, you won't get caught out. And because I'm not a big fan of books, and I've tried some of these books from the library, and I wouldn't recommend, if you're on a tight budget. I know it can be very difficult to sort of splurge on books. Some of them can be expensive. There's an F2 in surgery from Imperial College. His name is Mo Falaha, and he's got a YouTube channel called Doc Mo and Friends, and he's made 5 videos all about what you need to know for applying to the AFP, and tips in interviews that you may pay a lot of money in courses to get. So that's a great resource. Check it out. I'm more of a video guy rather than a book guy, so it helps me. I hope it helps you. Good luck, guys.
Well, thank you guys so much. It's been really, really interesting chatting to you, and it's lovely to hear your personal stories. And it's really nice to hear that, you know, there's lots of different types of people who do AFP jobs, and there's lots of different ways really to approach the interviews. But as long as you're confident in your abilities and confident in your clinical scenarios, that sounds like that kind of preparation is really worthwhile. So yeah, thank you guys so much for joining me again today. It's been really, really nice to see you again. I've really enjoyed our time together. I'm sure our viewers have too. And join us next week for part 6, where we're going to be talking to Dr. George Miller about opportunities after the academic foundation programme. Thanks, everyone.
So my name's Zaid. I am an F1 in West London, and I just completed the Medics Academy Training in Teaching Day 3 course.
I think it's structured in a really nice way with a lot of resources you can permanently access. The course isn't over after 3 days. You've got a ton of online content that you can always revisit, and I think that is fantastic.
I thought it was a great way to learn through having a full day at the start and then 2 later days of self-study. It really allowed for flexibility and allowed us to fully engage in the course.
It also made me feel better prepared to deliver teaching remotely or digitally.
It's really interactive. There's a lot of small group feedback session, exchanging ideas and learning people's perspective.
After actually doing this course, I realised that teaching is more of a science, and it's really important to get clear feedback so that you can improve your teaching.
This course also encouraged me to think thoroughly about what my audience actually wants from my teaching session, and also how I can keep them better engaged.
really great and fantastic to get such fantastic lectures from experts in the field throughout the 3 days. It was also interesting to learn from others taking part on the course because we all have different levels of experience, so it was interesting to gain their perspective on things too.
I learned not just about different style of teaching, I also learned about what is medical education, how to build a career in medical education.
Overall, I learned a lot from the teaching course.
I think it's a really well done course.
I really enjoyed it.
And I really found it very enjoyable.
That's what I thought of the whole course, and I really enjoyed it, and I would recommend it to other people.
So thank you for letting me participate.